Mohan Keshwamurthy. I am from Bangalore. I am Principal Director for Renal Sciences in Bangalore. Along with me is Dr. Nikki Raizada, who is Principal Director for Oncology, Hemato-Oncology and Hematology at Fortis Hospitals, Bangalore. Then we have Dr. Parth, who is also a pediatric hematologist. And I have Dr. Karthik Rao, who is additional director in urology and uro-oncology at Fortis Bangalore. We don't have Dr. Ritu Garg, who was our chief strategy and officer for Fortis India, and we have Dr. Kshitij. You're based here. So what we are trying to do today is to bring the ability of Fortis Healthcare to get cutting edge healthcare solution to the Northeast. This is a first time opportunity for bringing what is integrated and collaborative clinical practice in the areas of urology, uro-oncology, medical oncology, hemato-oncology, pediatric hematology, orthopedics, neurosurgery through physical interactions into the Northeast. The idea here is that a significant amount of skill that Fortis possesses can be deployed in the hometown of the people who matter for conditions that may not have optimal treatment options at this point in time. Over the next decade, the Northeast should grow to be a major hub for the rest of the country. It is now a tourist hub. It should grow into a hub of every capability, as repeatedly said last month by our Prime Minister Modi ji. Or twice a month, every speciality physically, and the intervening gap to be filled by telemedicine consults as and when necessary. The initiative will be cost effective because as today half the flights haven't landed, and flights are not easy from this part of the world, whether it be to Delhi, Calcutta or to the south. But since the ability of modern technology to bring in an opinion either physically or virtually is possible, it should be useful to the local population to have knowledge and skill integrated in their own hometown. I will stop here. I'll ask Dr. Nikki to speak, and then Dr. Kshitij to speak, and then take it forward if you have any questions.
I'm Dr. Niti Krishna Raizada, Principal Director of Oncosciences and Hematology at Fortis Group of Hospitals in Bangalore. We run a quaternary care center of oncology and hematology, which incorporates surgical oncology, medical oncology, precision oncology, radiation oncology, and high-end precision medicine, and of course hematology, pediatric oncology, and all subspecialties in onco and hemat. Now, what we want to do is, Guwahati is a confluence of all the Northeast states and also the countries in and around here. And this is what we want to cater, because we have a lot of patients who come from this area, and sometimes they find it difficult to travel all this way. So as often as possible, we want to physically come here and deliver our services. And also, when the patients come back after treatment, they need follow-up. So all those things can be practiced right at where they are. It's approachable for them and it is easy access to them. So we want to travel, at least we all functioning teams. So we have large teams who can travel once or twice a month and stay connected to our patients physically and also whenever possible virtually. So this is what we want to do, and actually take it on a system. It's not like for short period. We see how it grows, and then we can increase the frequency. If it is required more often, we can actually stay here for short 1 week, 2 weeks a month, so that we can extend our services.
মানুহে পুরো ট্রিটমেন্টের কারণে কিমান দিন বাহিৰত থাকিব লাগে, এটা কানেকশ্যন প্ৰপাৰ, দে ডোন্ট নো ৱেৰ টু গো। সো আমি ইয়াতে আমাৰ ছাৰ্ভিচেছটো ইয়াতে প্ৰভাইড কৰাৰ কাৰণে it will be better for the people, so they don't have to travel to like larger country cities, so they can come. We will come, আমি ইয়াতে আহিম আৰু আমি ইয়াৰে মানে monthly এবাৰ আহিব ভাবিছোঁ এতিয়া, আৰু telemedicine continue কৰিম, and as we go ahead আমি চাম আৰু কিমান facility we can provide to our people so that it is beneficial to our people.
Very good. Dr. Mohan, I am Additional Director of Urology. We are the fastest and the biggest robotic program in the country right now. So the advantage is we have 2 Da Vinci Xi robots, that is the latest Da Vinci robots, surgical robots at one location, which very few hospitals in the country have. The advantage of this is we do something called as the robotic transplant, both for the donor and the recipient robotically. And all high-end robotic neuro-oncological procedures like nerve sparing prostatectomies or nephron sparing, that is kidney sparing, partial nephrectomies, are done in high volume at our centers. Now the advantage of we coming here is any patients who have been operated by us or seen by us can come back to their own hometown, and the follow-ups, the next follow-ups can happen at your place instead of you people coming only for the follow-up all the way there to back. So that is one of the advantages of us coming.
My name is Chetan Singh. I am business head with Agilus. So I take care of Agilus operation for Central and East Asia. This part of the world is that we have good presence of lab network, and we are associated with Coating. And lot of the patient comes here and request why can't we start a OPD for Coating. So in collaboration with Coating, we have discussed internally, and finally we have been able to extend our services starting from this month in Guwahati, and probably looking forward and for the benefit of each and every patient who travel from this place to other part of Coating or to get the treatment, the benefit they can get from here.
If there are any questions, I will answer.
Okay, go ahead.
Thank you.